one thing I've heard very little talk about is the cost-sharing reduction payments, which for people under 200% of poverty is going to dramatically reduce their cost sharing and make healthcare much more accessible. Then, of course, there's the problem of narrow provider networks, narrow formularies, problems of people who have coverage being able to access drugs and providers that they need. But that's something a problem that I think snuck up on people a little bit. I'm a consumer representative of the National Association of Insurance Commissioners, and they just finished their spring meeting last week and decided to make network adequacy a top priority issue for their Health and Managed Care Committee.
From what you've been able to see thus far, you've mentioned a couple, but what do you consider the failures of the implementation of the ACA up till this point?
I don't think that the subsidies are high enough for a lot of people to purchase good coverage. And that's just a function of how much money Congress was willing to spend, and it doesn't look like Congress is eager to spend more money on this. So one of the biggest problems has been the Supreme Court decision that made Medicaid expansion optional with the states, and almost half the states have not expanded so far. I think many of them will eventually. But that is, I think, the biggest problem, because it means that many people are too poor to get coverage, which is just insane.
If you could just also touch on the point that you were making this morning about the issues with the premium tax credits and where the challenges that you see with that as those move forward into the next tax season especially.
Yeah, there are a couple of problems. One is the problem of the family glitch, where insurance is affordable to an employee but not to the family. And in that situation, the family cannot get coverage through the exchange. Again, cannot get premium tax credit. So that's a huge problem. The other huge problem is the problem of reconciliation, the problem that people who are working in hourly wage jobs and working several part-time jobs and in and out of different jobs, there's absolutely no way they can reliably predict their income for a year. And if they underestimate, then they don't get the premium tax credits they're entitled to. They may not even be eligible for premium tax credits in states that don't expand Medicaid. If they overestimate, they're going to have to pay the money back. And that's going to come as a huge shock to people who may not have any resources to pay it back, or may be depending upon getting a refund to take care of some urgently needed expenses, and then find that it disappears because of reconciliation. So the original bill had some pretty tight limits on payback, clawback, and it's a real shame that those were taken out of there in subsequent amendments. I don't know. It seems like the directions that we probably should be going are not the directions that are politically possible right now.
Thank you so much for being with us.
Yeah, and thank you for the opportunity.